Our topic for today is about abnormalities in cell growth. But before that, we know that there are things in our environment that we see and we cannot explain. But we know that there is a scientific explanation about that thing. So I'm here to present the topic about abnormalities in cell growth. Abnormalities in cell growth are also known as congenital anomalies that are defects in anatomical structure or functions present at birth. And these abnormalities results from genetic or environmental agents during fetal developmental stages. One example is the limb abnormality, that form of a congenital defect that occurs in numerous manifestations in mammals. And also, the most common sites for these anomalies are distal limbs. So, under the abnormalities in cell growth, there is disturbance in development. Disturbance in development are most common during the embryonic stage, when the majority of the body's structure is developing. Developmental disorders includes anomalies, monstrosities, and severe deviations from the norm. The reasons of anomalies are not always recognized. However, one chemical that causes developmental defects in kids when given to a pregnant woman is known as a teratogen.
Malformation anomalies. Congenital anomalies are also structural or functional abnormalities that develop during pregnancy. These conditions, also known as birth defects, congenital disorders, or congenital malformations, develop during pregnancy and can be detected before or after birth or later in life. Some examples are heart defects, cleft lip and palate, spina bifida, limb defects, and Down syndrome.
Anomalies are congenital malformation, which are structural anomalies that develop at birth and include an organ or a portion of an organ. Anomalies also are caused by a range of factors, some of which are unknown. It is caused by a number of factors. The majority of it appear within the first week of conception. On the other hand, may emerge later in the pregnancy. Anomaly may be classified under the arrest of development, second, excess development, and the third is displacement during development. Agenesis refers to the complete absence of an organ, whereas aplasia is used to indicate incomplete development or underdevelopment of an organ. Abrachia. Abrachia, absence of forelimbs or a congenital lack of arms. Acrania, absence of cranium or a congenital partial or total absence of the skull. Next one is adactylia, absence of digits or a congenital lack of fingers or toes. Next, anophthalmos, absence of both eyes or an individual born without eyes. The next one is anencephaly, absence of brain or a congenital absence of all or a major part of the brain. Exencephaly. Exencephaly indicates that brain is outside the cranial activity or defective skull with brain exposed or extruded. The last disease under arrest of development is hypocephalia, incomplete development of the brain. The second part in arrest development is fissures. Fissures is on the head, thorax, and abdomen's median line. The Greek suffix "schisis" at the end of the nouns implies cleft. The first abnormality under fissures is the cranioschisis. Cranioschisis is a neutral tube defect involving the skull. In this defect, the cranium fails to close completely, especially the occipital region. Thus, the brain is exposed to the amnios and eventually degenerates, causing anencephaly. The second abnormalities under fissures is a cheilochisis. Cheilochisis, a cleft in the center of the top lip that is congenital cleft lip, and a genetic abnormality that is evident at birth. The next abnormality under fissures is palatoschisis. Palatoschisis, also known as orofacial cleft, is a group of conditions that includes cleft lip, cleft palate, and both together. A cleft lip contains an opening in the upper lip that may extend into the nose. Under fissures is richischisis. Richischisis refers to the cases of anencephaly with a contiguous spinal defect involving at least the cervical spine region and extending for varying degrees down the spinal column. The third part in arrest development is fusion of paired organs. The first one in fusion of paired organs is cyclopeia. Cyclopeia causes a child to be born with one eye, no nose, and proboscis. The second one in fusion of paired organs is Wren arcuatus. Ren-Arquatus is also called congenital condition that affects about 1 in 500 people, and it is more frequent in men, also generally asymptomatic and usually discovered by a chance.
Under excess development, we have number 1, congenital hypertrophy. For the A picture, it is a 2-month-old female with megalencephaly capillary malformation syndrome. For the B picture, the facial asymmetry. C picture, lower limbs hypertrophy, extensive hemangioma. For the D picture, brain MRI showed left hemimegalencephaly, closed-leaf schizencephaly, and periventricular band of heterotopia. Number 2 is the increase in the number part: polydactylia, polymastia, polymelia, polydenttia, polyosia, and polytelia. Polydactyly is the appearance of one or several supernumerary digits in the limbs of vertebrates. It is generally understood as a surplus to the regular digit number in the wild type of a given species. Different forms of polydactyly can be distinguished. Preaxial polydactyly refers to additional digits that are situated anterior to the median axis of the limb, whereas post-axial polydactyly are additions of digits posterior to the median axis. Furthermore, a supernumerary digit may occur in a single limb alone or in multiples on one or several limbs of an individual. Extra digits may represent isolated occurrences or belong to various kinds of pathological syndromes, and the separation of the extra digits from the regular ones can be complete or incomplete, giving rise to different extents of fusion of supernumerary digits with other digits, either of the soft tissue alone or combined with skeletal fusions. Supernumerary nipples or polytelia and supernumerary breasts, polymastia, are relatively common congenital abnormalities with an incidence of approximately 0.2% to 2.5% for polytelia and 0.1 to 1.0% for polymastia. Both of these deformities are observed to form along the milk lines that track from the axillae to the groins. Both supernumerary nipples and breasts form from a failure of normal apoptotic regression of the mammary ridges during gestation. Diagnosis of supernumerary nipples can often be made at birth. The most common site for polytelia is just inferior to a normal breast, whereas the most common site for an accessory breast is in the axilla. Polymelia is a congenital anomaly which is defined as the process of accessory limbs attached to various body regions and could be classified as cephalomelia, extra limb attached to the head; notomelia, extra limb attached to the backbone; thoracomelia, extra limb attached to the thorax; and pyromelia, extra limb attached to the pelvis. These anomalies are usually associated with genetic factors including thamogenes, chromosomes, and environmental agents. Deviation from dental formula has been seen in several species. Hyperdontia, also called polyodontia or supernumerary teeth, is seen most often in permanent teeth and can affect the incisors, premolars, or molars. Presumably, these teeth arise from overproliferation of the dental lamina during development. Supernumerary teeth tend to cause crowding and malocclusions, which can cause dysphagia, dental disease, and discomfort. In horses, supernumerary incisors are typically not extracted and are managed with regular reduction. For supernumerary cheek teeth, diastema, sinusitis due to oromaxillary sinus fistula formation are possible. Teeth are either extracted or reduced, often to prevent complications. Polyosia is an extremely rare type of congenital external ear malformation which is defined as an accessory ear that is large enough to resemble an additional pinna. The term mirror ear or accessory ear are sometimes used. Ectopia cordis is a rare congenital anomaly characterized by partial or complete displacement of the heart outside the thoracic cavity. Ectopia cordis is usually associated with other multiple anomalies and intracardiac defects due to developmental problems in the ventral body wall. Life expectancy in animals with ectopia cordis may range from 3 minutes to several years. Cases where the displacement is either through the sternum or the costae usually end with neonatal death. In other types of displacement, animals may live for longer periods. For displacement during development, we have number 1, organ displacements. Example, dextrocardia and ectopia cordis cervicalis. In dextrocardia, the heart is transposed to the right side, while ectopia cordis cervicalis, the heart is displaced into the neck. For the displacement of tissue, we have number 1, teratoma, which is a rare germ cell testicular cancer composed of cells that are not normally present in the site where it originates. These tumors are rarely described in horses, where they may develop due to cryptorchidism. Teratomas consist of cells. On the picture, it is a photograph of a 2-year-old Shih Tzu with a large dentigerous cyst, the R1, associated with an uninterrupted left maxillary canine. The condition was bilateral. The left maxillary third incisor and the left maxillary second premolar were absent on the radiographs. Odontogenic cysts are rare in animals, and some disagreement is associated with their classification. Odontogenic cysts are derived from cell rest of molluscs, cell rest of dental laminae, reduced enamel epithelium, or malformed enamel organs. Types of odontogenic cysts reported in dogs include radicular cysts, dentigerous cysts, and keratocysts. In contrast to other odontogenic cysts, radicular cysts are associated with an inflammatory infiltrate. They are also very often found in association with a devitalized tooth. In man, radicular cysts are thought to arise from the cell rest of molluscs, which reside within the periodontal ligament. The specific etiology of radicular cysts in dog remains unclear. Dermoid cyst is a cyst containing one or more imperfectly formed teeth. They develop along the midline during embryonic growth and occur because the epidermis fails to close properly. The result of this developmental abnormality is that isolated islands of the outer epidermal tissue become trapped within the deeper tissue. Dermoid cysts occur most frequently in the Rhodesian ridgeback dog. Cat breeds more commonly affected include the domestic shorthair and Burmese. Number 3, under the displacement during development, is the persistence of fetal structure. It includes the foramen, ductus anteriosus, and gyracus. In fetal life, blood entering the right heart largely bypasses the non-functional lungs through either the foramen oval or the ductus arteriosus. Persistence of a normal fetal structure, the ductus arteriosus, after birth allows for shunting of blood from the descending aorta to the pulmonary artery, leading to the volume overload and subsequently left heart failure. Number 4 is the fusion of sexual characters. Sex determination of the gonads is important for development of the sex phenotype, internal and external genitalia, and sexual behavior. Intersex conditions have been described in several domestic animal species. True hermaphrodites are rare and have both ovarian and testicular tissue and exhibit anomalies of the external genitalia. The karyotype is variable and may be a chimera, mosaic, or unknown. Pseudohermaphrodism, often referred to as sex reversal syndrome, is more common. Animals have one or the other type of gonad and external genitalia of the opposite sex. Animals may be XY, XRY negative or XX, XRY negative. In horses, the most common type is 64XY XRY negative. Some cases of sex reversal are believed to be due to a recessive autosomal gene. A monster is a disturbance of development that involves several organs and causes great distortion of the individual. For the most part, monsters possess a duplication of all or most of the organs and other parts of the body. They develop from a single ovum. They are therefore the product of incomplete twinning. There are two classifications of monster. Number 1 is the twins entirely separate, and number 2, twins united. Twins entirely separate. Although separate, these twins are in a single chorion. One, as a rule, is well developed, the other is malformed, which is called the acardius. In the malformed fetus, there is arrested development of the heart, lungs, and trunk. Such monsters may lack a head, which is the acephalus, limbs and other recognizable features, which is the amorphous, or the trunk, which is called the acormus. Twins united. These twins are more or less completely united and are of symmetrical development. It has 3 types. Number 1, anterior twinning. Number 2, posterior twinning. And 3, twinning almost complete. For the first type of twins united, number 1 is the anterior twinning. The anterior part of the individual is double. The posterior is single. Pygopagus. The twins are joined dorsally, sharing the sacrococcygeal and perineal regions. They face away from each other, share the sacrum, coccyx, and part of the pelvic bones. The spinal cords are usually separate. 25% share the lower gastrointestinal tract and have a single anus and 1 or 2 rectums. In 15% of cases, there is a single bladder. There is an increased incidence of vertebral anomalies, including hemivertebrae, hemisacral agenesis, and thoracic anomalies. Although the pelvic conjunction is fundamentally different than in ischiopagus twinning, the types are similar insofar as numerous other associated orthopedic anomalies have been reported in association with pelvic conjunction, such as hip subluxation or dislocation, congenital vertical talus, talipes equinovarus, sprained shoulder, and scoliosis. There can also be a variable degree of spinal and cord fusion. Although there may be only 1 anus and rectum, the remainder of the intestines are usually separate. The upper bodies are not fused, and there are 4 arms and 4 legs. The cephalus. It has 2 separate heads in which doubling may affect the neck, thorax, and trunk. The prosopus. Doubling in the cephalic region without complete separation of heads. Only the face is doubled. Number 2 is the posterior twinning. The back is double-sided, whereas the front is single-sided. Here are the examples of posterior twinning. Craniopagus. The conjoined twins share the skull, meninges, venous sinuses. The brains are usually separate, although some cortical fusion can occur in 33% of cases. Example number 2, cephalopagus. The twins often have a fused thorax in addition to a fused head. The single fused head may have 2 faces facing away from each other. One face may be rudimentary. These twins are terminated or die in utero. They are non-viable. Lastly, dipigus, doubling of posterior extremities and posterior part of the body. Ischiopagus, the twins may lie face-to-face or end-to-end. They have 2 sacra or 2 symphysis pubis. They may share the lower gastrointestinal tract or the genitourinary tract and may have crossing ureters. The twins can be tetrapus, tripus, or bipus, although the most common arrangement is the presence of 4 legs. Pelvic conjunction leads to complex urogenital and orthopedic anatomy. The kidneys usually function normally but are often malrotated or ectopic in location. When 2 bladders are present, they lie side by side in a collateral position, or they may lie in a sagittal midline location with one bladder draining into the other. The ureters frequently cross over and insert into a contralateral bladder such that they will need to be rerouted during separation. Partial urethral duplication is possible, but a single urethral orifice is typical. The distal gastrointestinal tract is often shared with anorectal agenesis and rectovesical fistula. Contrast studies are necessary to delineate distal bowel anatomy. Urogenital sinus or cloaca may be present. In boys, there is an increased incidence of undescended testes. Number 3. Twinning almost complete. Duplication of the whole trunk or the anterior or posterior extremities with fetuses arranged in a parallel ventral pattern. The pair is linked in the thorax and in certain cases, the abdominal region. Examples of the twinning almost complete. Thoracopagus. The twins lie face to face and share the sternum, diaphragm, upper abdomen wall, and liver and have an exomphalus. In the majority of cases, they share the pericardium, which is 90%, and heart, which is 85%. They may have a common small intestine, which is 50%, which joins at the duodenum and separates at the ileum. The biliary tree can be joined in 25% of patients. There may be associated cardiac anomalies such as ventricular septal defect, atrial septal defect, and tetralogy of Fallot. Brachypagus, thorax and lumbar portion of the spinal column are united. The evolution of all the double monsters mentioned is usually symmetrical. They may, however, have uneven growth, with one of the two being smaller and less developed than the other. The parasite is the less developed form, whereas the oocyte is the more evolved form. The parasite is frequently partially encased in the oocyte.
What is pathogenesis? Pathogenesis is the sequence of events that lead to disease development in the host, or the progression of disease development from the first encounter between the pathogen and its host to the end of the syndrome. First key basic concept of human developmental disease: the intrauterine development of humans. First, an injurious substance destroys either enough cells to induce death and abortion or only a few cells, allowing the embryo to heal without acquiring abnormalities during the early embryonic stage, the first 3 weeks following conception. The embryo is particularly vulnerable to teratogenesis between the 3rd and 9th weeks, with the greatest susceptibility acquiring during the 4th and 5th weeks. Organs are formed from the germ cell layer during this period. This organogenesis process, regardless of its type, is very vulnerable to injury. Second, following the organogenesis, the fetal stage is marked by continued organ development and maturation, as well as substantially decreased sensitivity to teratogenic chemicals. However, the fetus' previously developed organs are still vulnerable to the growth retardation or damage. As a result, if a teratogenic substance is exposed at different periods throughout pregnancy, it may be varied consequences. Second key basic concept of human developmental disease: the gene that regulates morphogenesis may be the target of teratogenesis. 1. Agents that affect Hox gene expression have been found to cause deformities in experimental animals. At least part of teratogenic effect of some drugs are now considered to be mediated through Hox gene regulation. Second, human abnormalities are caused by mutations in two of the PAX gene, PAX3 and PAX6.
Etiology, the study of causes. For example, a disorder. The word etiology comes from the Greek atia, cause the logos, or discourse. This etiology grouped into two major categories: Number 1, genetic, and the second one is environmental factors.
The first major category of etiology is genetic. Genetic factors clearly impact diseases that are produced by the environment. Here are some examples of genetic conditions. Some cancers, cystic fibrosis, high cholesterol, hemophilia, muscular dystrophy, and birth defects. For example, spina bifida or a cleft lip. The second major category of etiology is the environmental factor. The environment may have an impact on certain genetic diseases.